This is 14-year-old Ariana Lalani, who is the reigning Teen Miss Africa and Uganda Sickle Cell Rescue Ambassador. Ariana is also one of the young people living with sickle cell in Uganda, but this has not held her back in pursuing her dreams.
I decided to not let sickle cell decide or rule out my life and make rules for me to what I do and what I can't do. Rather, I let it be an inspiration to all the other people out there who have sickle cell.
Ariana has even gone ahead to carve out a space for herself in the fight against sickle cell anemia disease in Uganda.
I think that we need more sickle cell advocacy in Uganda. A lot of times when children are born with sickle cell, their partners leave the wives alone to deal with all these situations, and I believe that they should work together.
Her mother, Winfred Lalani, has shared with us the experience of caring for her children born with this disease.
Well, number one, the challenges I would say mostly is the physical ability of what to do. Let's say if they're in school and if it's exercise, strenuous exercises, that affects them, because sometimes if they fall, then, at the end of the day, they have a crisis, because a crisis meaning what? Then they have some swellings on their legs and on their hands, depending on what, because there are different varieties as well of sickle cell anemia. Number two would also be the jaundice. I mean, it may not affect them physically, but it affects them emotionally. Some of them with the jaundice and the yellow eyes, you find that in the schools, they're picked upon and they're asked all these questions, which for their self-confidence is really, really a problem. So
Lalani is cognizant of the fact that her access to financial resources has played a key role in seeking for advanced medical treatment for her children. And it is this good fortune that has now sent her on a path to seeking for similar support for mothers in her position.
Because the challenge of some of them actually feeding a child of a folic acid and the painkiller, which is the basic of life, they do not have. So if we realize that together even $5 would make a difference. So we call out them to come help us. We reach out to these children.
According to the Ministry of Health, 200,000 children are born with sickle cell anemia disease every year. Meanwhile, 250,000 Ugandans are currently living with this disease. It is for this reason that government has expanded access to health services for sickle cell disease sufferers in the country.
The availance of some of the key medicines for sickle cell, including hydroxyurea, and they are continually building the budget and calling for more support for people to access, those affected people to access these key disease-modifying medicines.
As well as looking out for the ever-evolving technology that comes with treating this complex disease.
Disease of sickle cells underlying in the bone marrows. And when you are treating, when you remove that bone marrow, you are free of danger of sickle cell. Therefore, the technology that the government is trying to bring in this country of doing bone marrow transfer is the best.
But in order to reduce on the sickle cell disease burden in Uganda, there is need to encourage Ugandans to always test for this disease.
We still have a lot of work to do to increase awareness amongst our population and mobilize everyone in the country to come up and support the awareness and then the attendance towards the health services, including the testing for sickle cell, as well as the care for sickle cell.
Today, Mulago Hospital, together with Uganda Sickle Cell Anemia Rescue Foundation, organized a Christmas party for children living with sickle cell at Mulago National Referral Hospital. Joyce Nakato, NTV Weekend Edition.